The next important thing we shall be discussing is what are the different types of neck fracture. Types of neck fracture of femur. Neck fracture of the femur, right? So let me draw the femur first of all. So let us say that this is a picture of your femur, right? And this is your femur bone. Now here you have got some fractures. So here exactly here if you see the fracture, right? So this kind of fracture here is called as subcapital fracture. Okay, what is this kind of fracture? Subcapital fracture. Now just below that, if you see another fracture exactly in the center here, this is called as cervical fracture. Now just beneath the cervical fracture, if you see a fracture here, this is called as basal fracture. And finally you see the last fracture over here beneath your greater and lesser trochanter, and this is called as pertrochanteric fracture. So what are the different kinds of fracture which you have, guys? So the different kinds of fracture are, this fracture is called as your subcapital fracture, right? And this fracture over here is called as your cervical fracture, and the remaining two, this one is called as your basal fracture, and the last one is called as pertrochanteric fracture. This is called as pertrochanteric fracture. Now out of all these fractures, which fracture is very important to us? Which is dangerous fractures here are, one is your subcapital as well as cervical fracture. These two fractures are dangerous. Why? Because these two fractures are intracapsular. They are located within the capsule. Intracapsular. Whereas if you see pertrochanteric fracture, this is extracapsular. It is outside the capsule. Extracapsular. And most important thing you need to know is that here exactly you have an artery. You see this artery? This artery is touching and going what two fractures? It is touching and going the suboccipital fracture as well as the cervical fracture, right? So if there is a fracture here in these two regions, don't you think this artery will be damaged? So if this artery is damaged, what will happen? This artery mainly supplies the neck as well as the head of the femur, and if this artery is damaged, then this will lead to necrosis. What this will lead to? This will lead to bone necrosis. Okay, and what is this artery, by the way? This artery is called as a reticular artery. So damage to the reticular artery, it will lead to bone necrosis. And what type of bone necrosis you call it as? Aseptic bone necrosis. Okay, so this is one of the very important clinical point which you have to know.